Hi, it's Dr. Gladden. I'm going to be walking through some Max Pulse interpretations with you based on kind of how we go about uh, looking at them. Um, the um, the first one that we're looking at here, we'll start with the aging vascular health, which is the waveform. Um, what we've come to understand is that the waveform is really a function of endothelial function. The waveform is not fixed. It can move around in the course of a day. This person is 100% type 2, which is good but not optimal. And so as a treatment plan, we'd be looking to optimize them, moving them from type 2 to type 1. There are various supplements and interventions we can do that will actually do that in a matter of an hour or two in the office. And it's important for this particular patient that we try to optimize them in that direction. Um, the next thing that we look at is that I look at is the eccentric contraction and arterial elasticity. Residual blood volume, if you will, is a function of the elasticity and the contraction of the artery. So we're looking for an artery that's supple and elastic, and we're looking for one that has the strength to contract and sort of function, if you will, as an auxiliary pump to the heart. The DPI is simply an index of all three of those scores, and the residual blood volume is kind of a secondary variable. That's really a function in my mind of how much contraction there is, how much elasticity there is in the artery. So here again, this person is in a normal range, but not in an optimal range. Our feeling clinically is that this relates directly to endothelial function as well, and in addition, specifically can be enhanced by enhancing nitric oxide production. Um, the next thing that we look at is basically the heart rate variability. And heart rate variability here, the average heart rate was 50 with the highest of 54 rather, and the lowest beat to beat giving a heart rate of 45. So obviously that's measured based on R to R interval and then extrapolating it out to 1 minute. There were 4 artifacts here, so we know that we have a good quality study. Heart rate variability here is good in the sense that when you look over at the panel that shows sympathetic nervous system in red and parasympathetic nervous system in blue, the patient seems to be parasympathetically dominated, if you will. And that's a good thing. People that have a lot of stress or have higher sympathetic tone can have higher incidences of arrhythmia, sudden cardiac death, hypertension, etc. So that looks good here. Total power, we look at total power and then very low frequency, and high frequency. So total power for us can be correlated with several different things, blood flow to the heart, mitochondrial function, hormonal balance, specifically thyroid, potentially hypothyroid, actually potentially some of the sex hormones as well. Ideally, a person would have good power. The black marks there are one standard deviation around the mean. It's not uncommon for us to be able to push people above the black lines there for total power, indicating in our mind that they have good electrical activity, which is indicative of good underlying substrate for mitochondrial function, hormonal balance, and blood flow. The very low frequency is correlated with sympathetic nervous system. Low frequency is a balance between sympathetic and parasympathetic, and the high frequency here is, as it always is parasympathetic. And so this person is parasympathetically dominant. We would like for this person to have more power, total power, and so that would be a focus of intervention. And then this translates down into us looking at their stress score. Physical stress here is low for this individual. Their stress resistance is high, or not high, but normal, higher, and their mental stress is low. So it gives them an aggregate stress score of 40. What we're looking for here is that in well-trained people, the physical stress will be even lower. The stress of simply sitting in the chair will be extremely low. People that are quite debilitated will show very high physical stress just sitting in the chair having the test performed. Stress resistance is something that we use to train our athletes with, and ourselves for that matter. It gives us insight into what kind of exercise we might want to perform on a given day. So with a normal stress resistance, we would go at things in kind of a normal fashion from a workout standpoint. For our athletes, we would almost put them into a recovery kind of day, because typically when they're in their prime, they have a very high stress resistance. They really kind of peg the meter, if you will, all the way out to the far right, and that's when we know they're really good to go for a hard training session. We've done a lot of looking at the max pulse through the course of a day and also through the course of a training session, and it's quite interesting how it changes in a very dynamic fashion, sort of like heart rate would change or blood pressure would change. So when you get this, don't think of it as a static test that is giving you a snapshot of what the person is like. It's really giving you a snapshot of where they are at that moment in time. We'll talk more about the exercise as we go along here. Slide number 2. Let's see, not able to change the slides here. Second. Let me pause this. Okay, this next max pulse that we're looking at is a 73-year-old male. Again, we'll start by looking at the waveform. He has a type 4 waveform that's predominant, but also showing some type 7, 5, and also some type 1. Sometimes we see this sort of waveform pattern. When I see it now, I many times will repeat the test because if the transducer is not positioned properly on the finger, if it's rotated left or right, and isn't kind of on axis with a nail bed, we found that it will skew the results. Also, it's very important that the person be in a relaxed mode and have their arms on the table, but that the edge of the table is not pushing into the forearm, because that can compromise blood flow, if you will. So having the arms in a neutral position up on the table becomes important, having their feet flat, keeping them from speaking. So in this particular instance, I would probably repeat this because it's kind of a scattergram, if you will, across the different types. If the person is truly type 4, then they have some issues that we would want to deal with. The next thing that we would look at would be their arterial elasticity and residual blood volume and eccentric contraction. Eccentric contraction seems to be good. Based on this, they would have very stiff arteries and almost no residual blood volume, or a very high residual blood volume. So again, I would probably repeat this because I'm starting to think that potentially this doesn't make perfect physiologic sense. When we then go and look at the heart rate, we can see that the average heart rate is 58. The highest peak heart rate is 79, the lowest 44. So there's certainly good range there. But then when we look down and see the artifacts are 39, now my suspicions that maybe this is not a good study are being confirmed. So I would definitely repeat this study and probably wouldn't pay too much attention to the rest of the data until I'd repeated it. I think the take-home message here is that when you have a lot of artifact beats or you see something that doesn't look like it's making sense physiologically, go ahead and repeat the test. The next max pulse that we'll look at is a 50-year-old male. Here, this person seems to have a nice clean recording. Waveform is type 1 predominantly with some type 2. We also see this mix very frequently in people. It's rare that people are 100% one type, although common at the same time. I suppose not rare, but certainly not uncommon to have a mixed bag. When we look at their eccentric contraction, arterial elasticity, residual blood volume, we can see that they have good contractility, that they have normal elasticity and a normal residual blood volume. In a perfect world, we'd be improving their endothelial function and nitric oxide system and glycocalyx, etc., and moving the waveform from type 2 to type 1 at the same time that we would be improving their elasticity. When we look at the power outputs here and the balance between sympathetic and parasympathetic, we can see that they're sympathetically dominant. This is also a very common finding that we have. The majority of people that we see are not Zen-like and parasympathetically dominant. The majority are sympathetically dominant. You can see that they lack power, however. Total power is down, very low frequency power is down, low frequency and high frequency, all the domains are down. I would be thinking here about potential thyroid issues, number one, followed by potentially some decrease in mitochondrial function and potentially some perturbations in hormonal balance. Those would be the things that we would go after. When we look at their stress levels, their physical stress is normal, mental stress is normal, and stress resistance, however, is quite low. So if this were an athlete, we would basically be recovering this person, either with a very active recovery kind of protocol for exercise or even a rest day. Their stress score is up at 57 over 100. We'd like it in aggregate to be below 50. And so this looks to me almost like we would see in someone who had just completed an exercise program. One of the things that we'll see is that the resting heart rate will be higher, as this person's is at 81. Even if they started with replete with power and were above the hash marks, exercise depletes the heart of energy, and we'll see total power drop. We'll also many times see a drop in sympathetic nervous system tone and a rise in parasympathetic nervous tone. Physical stress will increase off a baseline and stress resistance will go down. And it's possible for those to go the entire distance of the scale there. Physical stress can be very low to start with and very high at the end of a stressful workout. Power can be markedly above the hash marks and then go below. So this next person that we're looking at here is a 31-year-old female. Looking at the waveform, they're predominantly type 2 with a little bit type 1. So we know endothelial function is not optimized. You know, eccentric contraction, elasticity, the artery is quite stiff, so we really know endothelial function and nitric oxide function are not optimized for this person. The DPI, I don't really put much weight on. I really am dissecting out the eccentric contraction and elasticity. And the residual blood volume is going to fall sort of where it may, and that's going to be secondary to the degree of elasticity and eccentric contraction that there is in our estimation. So when we look at this patient's total power, it's actually reasonable. When broken down into the 3 different frequency domains, very low frequency, low, and high frequency, they are all pretty good, and you can see that this person is pretty zen-like. Their parasympathetic tone is dominant. Physical stress is quite low. Stress resistance here is very high, and mental stress is low. So this would be, for an athlete, this would be a good day to work out really hard. They have a low stress score of 14 over 100. And we would want to be focusing on, with that degree of stress resistance, is there a way that we can augment power for them even further through diet, supplementation, etc., taking away things that might inhibit mitochondrial function, and then also trying to improve their elasticity, which we feel correlates with endothelial function. The next client we have here is a 31-year-old female showing a type 4 waveform, again with a smattering. And so I'm starting to wonder, is this really a good quality study? The eccentric contraction is suboptimal, elasticity is very low, residual blood volume is low. This is probably a study that I'm going to repeat in a 31-year-old female. We found that the vessel types, although they're presented as anatomic interpretations of degree of atherosclerosis, are really much more dynamic than that. I think these types really reflect vessel physiology with a smaller contribution of anatomy rather than the other way around. So I would be probably repeating this study. When we look at total power, the power is good. They're really sympathetically dominant. Physical stress is normal, but mental stress here is very high, which can correlate with sympathetic nervous system. And we've seen that be a good correlate for many, many people, being able to ferret out their level of mental stress. We've also been able to show that exercise can lower mental stress, as can using CardioMath or other breathing techniques to lower mental stress. So you can use this test actually to help you determine if you're really having an impact on lowering somebody's stress level. Stress resistance is fairly normal to low in our estimation, and the total stress score is 60. But again, I'd probably be repeating this test. Next, we have a 46-year-old male. He's predominantly type 3 and has a bit of a smattering, of course, up to type 1 there. His eccentric contraction and arterial elasticity look pretty good. Because of his high elasticity, the residual blood volume appears to be quite low. And when we look at his power is actually quite good. He does have 17 artifacts, however, so again, I'm thinking about probably wanting to repeat this, this test. Average heart rate was 53. There's a good range of 76 to 45. And then when we look at his sympathetic to parasympathetic nervous system balance, they're actually in balance. Physical stress here is very low. This is what we'd expect to see in a fit individual. Stress resistance very high. So total stress score of 8, a great day to exercise hard, but based on the number of artifacts and the waveform, I probably would be repeating the test as well. And what you'll see when you repeat it and you get the probe aligned properly is that the waveform will either straighten out or be indicative of significant endothelial dysfunction. Next, we have a 46-year-old male. So here we have a 91.8% type 1, 8.2% type 2. We have physiology that corroborates the waveform there with an eccentric contraction that's optimal, elasticity that's optimal, and residual blood volume that's optimal. This is someone who's appears to have a healthy and intact endothelium. Their average heart rate is 79 with a peak of 75, low 53 based on the art-to-art interval. It's a good quality study because there's only one artifact, and their total power is good. Sorry, I think we just jumped. Yeah, total power here is good. Very low frequency power is good, low frequency and high frequency. They're sympathetic dominant, but they're also reasonably well balanced, not as sympathetically dominant. So their stress score comes in at under 50 at 45. Their physical stress is low, but not as low as it could be. Mental stress here is low, but stress resistance is actually quite low. So again, it would be more of a routine workout recovery type day for an athlete, but this appears to be a good quality study, and we would run with that interpretation. Next, we have a 72-year-old female. There's 0 artifacts and has a waveform that's predominantly type 4. So now we're starting to think, okay, this is probably real physiology. Eccentric contraction is suboptimal, arterial elasticity is suboptimal, and residual blood volume is consequently high. And what we're thinking here is that this person has significant endothelial slash potentially anatomic disease superimposed on the physiology of the arteries. So it would be interesting for us to see if we could actually improve that waveform using some of the things that we know will improve endothelial function. When we look at power, the power is a bit down, so we'd be thinking about hormonal situations for them, as well as mitochondrial function. Parasympathetic tone is dominant, which means that they're relatively zen. Let me go back. And physical stress is normal, mental stress is low, and stress resistance is normal. So this is a person with a stress score of 50. They're not in great shape. Certainly not at this particular point in time. The endothelium's not working well. Power for them is low, so we'd be looking at ways to improve their power, improve their endothelial function, and understand what their anatomy is inside the coronary arteries and their arterial tree in general for this particular individual. And I believe that's, now here's one more. So this is a 72-year-old female, average heart rate of 83, but there's 25 artifacts. So they're type 2. So I'm thinking that we might want to repeat this. We wanted to include a lot of real-world studies for you so you could get a sense of how we use this and how we become skeptical of it, and then when we're more likely to trust it. Apart from the 25 artifacts, the physiology here looks pretty good and believable, with eccentric contraction being just optimal, elasticity being normal, and residual blood volume being optimal. Physical stress is low, mental stress is low, stress resistance a bit higher, and power looks pretty good across the board with a nice balance between sympathetic and parasympathetic. I would probably be inclined to repeat this test and see if we can get the artifacts to go quite a bit lower. We'd like them less than 8, and see if this is true. But some improvement, let's say it is true, then doing some things to improve endothelial function would appear to be important here. Mitochondrial function, hormonal balance appear to be adequate. Certainly they're in balance with regards to their sympathetic and parasympathetic nervous system. So we'd be focusing primarily on the endothelium for this particular individual. And I believe that's the last of the slides.